The patient and family involvement in our transformation program has been very exciting work for us. Our Patient and Family Advisory Council has been working for about 3 years now, and they even form our strategy. They've provided input on a number of different areas in the hospital, our wayfinding.
Patients bring a lot to our events. The first thing they bring is an experience that we don't necessarily have as caregivers. The other thing they bring is they kind of keep us honest. So when we're there, talking about what we can do to help patients, once in a while one of them will say, well, that doesn't really help me. So we have to come back and do the routine checks. Would this be better than that? And they help us provide the answer to that.
I became involved with the Patient and Family Advisory Council in 2010 as a result of having taken care of my elderly neighbor. And so I wrote a letter to the president of the hospital, who wrote back to me and invited or gave me some information about the Patient and Family Advisory Council. So I thought, well, if I'm going to complain, I should put my money where my mouth is, and I applied to join. My opinion was certainly sought and respected, and it was a wonderful experience.
The rapid improvement events are an opportunity for the hospital to work with the resources it has, with the manpower it has, but without adding any dollars to the department or the work that they're doing. So it's really looking intrinsically at improvements, which I find to be a really powerful way to look forward at the future. Working with the staff at the hospital was really rewarding. I found it to be a very transparent situation where the nurses, the physicians, all of the staff were very transparent in what they were sharing with me in procedures, in the way they worked.
I visit a lot of patients. Being of an age when a lot of my friends their health is suffering, and I hear a lot of complaints. But so few people are willing to take those complaints beyond just grousing. And I'm thinking, this is one avenue where you can perhaps make a difference. And it feels good to be able to get your point across, to be able to communicate what your problems have been.
The interactions with the staff, whether they were nurse clinicians or physicians, was great. If anything, I found that they were listening very acutely to what we were saying, really wanting to know how things were from the patient perspective, what could be done differently, incredibly transparent and supportive.
I think having patients involved or informed about what's happening in emergency benefits everybody. It benefits the hospital, it benefits what we're trying to do to provide better patient care. With all the events we've had, people realize now that I'm getting letters saying that, I was in there and within 5 minutes I had a cardiogram, I had blood work done. That's amazing, because I was here 2 years ago and it took forever to get in. So having their input and giving them back the feedback of what we're doing with these events is crucial and very beneficial.
We're focusing on what provides the best patient care for every patient, every day, no matter when they come and what problem they come to us with. And the best way to focus on what they need is to hear their stories and have them being involved firsthand in designing the care of the future.
So anybody that can spare the time, I would say yes indeed, by all means, take whatever opportunities there are to get that message across.
Being involved with the council is a great opportunity to make a difference and to offer your outside eye as to what could be improved, what could be done differently.
This is about patients. What we're trying to do on our road to perfect care is to do systematically what actually helps patients. So it's about them. Why don't we listen to what they have to say about what we do with them?
I really enjoyed being part of the rapid improvement events. I found the staff to be very forthcoming and very honest with how their workday flowed, so I was able to be creative and help them find solutions.
Any patient that has an experience in emergency that they feel that they can better in any way, I feel should be able to come and sit on an event. They shouldn't be afraid of it. We've asked people if you want to sit on events, they've come forward. I've gotten names of patients that comment and say, the next event I want to be on it because this is what happened to me, and we say, great, come on board.
I think that this is a positive way in which one can influence healthcare. We all have opinions about healthcare, and we've all had experiences in healthcare, and it's all well and good to sit back and complain. But if you really want to make a change, you have to make a commitment, and I think anybody would be pleased to do so, because this committee certainly gives one all the respect and satisfaction that is required.